Hi everyone. On this video blog I want to talk about two things. One of the things that a message that we're trying to get out there is that pressure ulcers do not equal poor care. Oftentimes family members and surveyors and many other people who come into nursing homes and they see pressure ulcers, they immediately think there's poor nursing care involved in the patient care. And that's usually not true. Patients who are in nursing home are much sicker. They have a lot of issues going on and they need to be taken care of course, and all their risk factors need to be assessed. So please call us and try to get these pins from us, the pressure ulcer does not equal poor care pins, and help us with our movement to make some change in the minds and hearts of those who may have the stigma about pressure ulcers. The next thing I want to talk about is something that we've been getting a lot of interest in social media, and that is our FTAG blog for nursing home surveys. And for many of you who work in the nursing home field know that nursing homes are surveyed once a year, and they're usually surveyed by the health department, and they're given these mandates by the federal government called FTAGs. And the first FTAG I wanted to go over with you is FTAG 314, which is the major FTAG. And that basically mandates that a resident who enters a nursing facility does not develop a pressure ulcer unless it is an unavoidable pressure ulcer. And that's one of the most important things about having skilled wound care do weekly rounds with one of our physician staff or physician assistant staff to make sure that we're assessing the wounds early, whether or not they're avoidable or unavoidable, especially if they're pressure ulcers, and not just sweeping them under the rug and giving them a low stage diagnosis hoping that nothing will happen. Because as we all know that these ulcers usually do progress and they can get really, really bad. The next FTAG that I will talk about is FTAG 157, which mandates notifying a physician of changes in wound health. And this is very, very important. As the wound changes, it may improve or it may get worse. It's very important to have documentation on the physician's side as well, and that's one of the things we pride ourselves on, is having in-depth documentation in this area. The next FTAG is FTAG 281, and this mandates the use of correct wound dressings on wounds. And as some of you know, there's just so many different wound dressings out there, and you really need to have a physician order backing up the nursing order as to which wound dressings to use, and you have to use the correct ones. And just using something to just slap on the wound is not the best choice, because it may be the wrong dressing. Or if the wound is diagnosed incorrectly, you may also end up using the wrong dressing as well. The next FTAG that I'd like to talk about is FTAG 385. And this mandates adequate supervision for wound care in the nursing facility. And that's really actually adequate physician supervision. So there are actually mandates out there that say that physicians should supervise the wound care in a facility, and oftentimes we're told that the wounds are doing fine, they don't really need any help, they don't really need any assessment, and a health department survey comes and they may disagree that no physician has seen the patient with the wounds for maybe 3 to 6 months. So be very careful about that. FTAG 501 mandates medical director involvement in the wound care program. This is important to get the medical director involved in the wound care program, especially in QA meetings or in wound care meetings, and speak to your medical directors about that. The last one I'd like to talk about, and one of the things that's very important to us at Skilled Wound Care, is pain. Pressure ulcers are associated with a lot of pain. They're like a big paper cut, and FTAG 309 mandates the appropriate management of resident pain. So if you do have a patient with a pressure ulcer, you are mandated to really control their pain. And it's not good enough not to change their dressings because they're in pain. You actually need to formulate a plan of giving the patients the correct pain medication while you're doing their dressing changes. And you can speak to us and the physician staff to really come up with a good pain regimen. Whenever we round or if we do any bedside procedures, we like to pre-medicate patients as well as apply topical anesthetic to the wound before any procedures are done. Once again, pressure ulcers do not equal poor care. It's very important to have great documentation, both by the nursing staff, and the nursing staff does an excellent job, and the physician staff working hand in hand as a partnership with us to provide really that great care and great documentation to make sure and bring that awareness to surveys, possible legal reviews, and everything else. And one of the things that's happening right now is we're seeing an uptick in elder abuse lawsuits, and one of the things that they look at after falls is pressure ulcers and wounds. So the documentation really needs to be up there, and I would say that Skilled Wound Care provides some of the best documentation around, and also a clear and knowledgeable understanding by your physician staff of these F tags, which we go over and over again to make sure that we have the facility covered. I'm Dr. Bardia Anvar, and I will see you on the field.